Hi everyone, we're getting close to the end of the semester and this is PowerPoint 18 and then we're going to also have 19. This PowerPoint is a really important one and has to do with assessing parents' ability to change their own behavior so that they can implement these wonderful functional behavioral assessments that you've been working on all semester. And so this comes in regards to in particular, Child Protective Service cases in which you're dealing with children and families, and you're trying to determine if they're even able to implement behavioral change plans for the family. So a lot of this information, most of the information is coming from this great document from the University of Bristol. It's England. I kind of changed or the UK, I kind of changed some of the language so that it fits more with what we use in the United States in terms of our wording from a social work model. But this does help us in particular determine whether the adults that we're working with day to day can handle and have the ability to carry out the changes. And so if you look at the language that they're talking about, it has a parallel language from our functional behavioral assessment book. And so I'm hoping that you've now, especially after that test 2 and all the agony you went through, I'm hoping that now you're starting to integrate and understand how these concepts work. So I want to give full credit to this this document, and let's talk about how that applies to your work with kids. So when we are doing a functional behavioral assessment, and then part 2 is our behavioral support plan, it's going to require the ability and willingness of some adult to help implement the plan. And this can be the parents in the home, it could be the teachers in the classroom, it could be caregivers, it could be a grandma or grandpa. But what happens when we conduct an FBA on caregivers, we are basically determining if they have the ability to carry out even a basic care plan for a child. So for instance, we might be called in to a daycare center in which a child is acting out, hurting other children, and is being very aggressive. And so we pinpoint the behavior we're going to look at, which is going to be the aggressive behavior. And we decide in our behavioral interview that we are going to interview the parents, okay? Parents, grandparents, and any other important people who are going to give us some history. And while we're doing that history, we realize that the parents are expressing that they're using harsh discipline at home, maybe to the point of abuse, and we feel like we have to make a referral on it. So we make a referral and come to find out this family's been in the system before, and now they're looking to you as an early childhood interventionist to give them a foundation for what needs to happen in order for the best interest of the child. And so all of a sudden you shift from the problem being the child as the identified person to the parents. And then when you're trying to deal with the parents, they're maybe hostile or don't understand how it got shifted to them, when really in their mind it's the child that causes the problem. So this is the direction we're going now, is trying to determine the assessment of the parents. And so APECC basically means assessment of parental engagement and capacity to change. And so this document pulls together all the social work methods and assessment measures that are free and that you can use them without any special training. And so that's what's nice about this documentation, is that it helps put together some very simple assessment tools, as well as doing your typical psychosocial study and pulling these things together. So it's designed for important decision making where a child's life is at stake, or possibly the placement in the home or a daycare center or a school is at stake. So, can a parent make the necessary personal changes to promote a child's well-being? And so the components of that is, can they engage with you as a parent to professional? Are they going to bond with you and work with you? And can you provide proof that the engagement and the work that you've done has been successful? In other words, is it measurable, the changes that they've made? Can you prove or disprove that the changes have helped with the child? So how can we prove that the change also can be sustained? So just like with your own personal PMPs, you went through all that assessment method, you went through finding your baseline, then you tried to implement something for just 30 days, and this was not it was not a behavior that was going to have anything to do with the life of a child or losing a child, and yet the same principles apply. If a parent is spanking a child, what is the function of their action? What are they trying to do? Are they trying to get the child to stop? Is it an escape, or is it trying to access something? And so we still have to think in terms of what's the function of the behavior, and then based on the function, what are our intervention methods? And if we're working with parents, again, we may not want to use our fancy terminology for how we're going to implement things, but we have to be sure we can assess whether they can complete what we're asking them to do in a very complicated way. So a change assessment is basically looking at all the factors. What are the needs of the child involved? What is the parent's capacity for handling those needs? What's your assessment of the family and environmental factors that are involved with this? And identifying the priority difficulties that impact the child's safety. There may be things going on in the home that you don't approve of as a parent, but the things that you want to identify, the problem behavior, the identified behavior, and the function of the behavior should be focused on the things that are impacting the child's safety. And then it involves an analysis of pulling together all these findings from above to see what can be done, what kind of action, and how can you. So the practice elements that go into this is how the parents are, which is basically what is their capacity for change. And then the second part of it is what the parents do. In other words, what will they do with the opportunities and the services that you're going to provide for them? How are they going to use those to facilitate change needed for their child, or not? Are they not going to do that? And so those are the two questions we are asking ourselves. So parental capacity to change, these are the definitions. So parental capacity is basically the parent's overall ability to just parent a child, the simple parts of parenting a child. Do they have that ability? Can they feed them? Can they change their clothes? Do they know how to take them to the doctor? Do they know how to enroll them in school? And then we have the parental capacity to change. That's different. This is each parent's attributes or capabilities and motivations. What is their psychological needs? What kind of family environmental factors? And how do those enable the parent to actually change their life to benefit their child, or do they not have that capacity to change? And then we measure parental engagement. And this is basically a person's capacity to enter into a mutual and purposeful behavioral interaction between the services that you're providing and the interventions you're providing. And so in other words, can they engage with an agency? So they may be able to change on their own. They may be able to take care of their child, but it doesn't mean that they're necessarily going to have what it takes in order to interact with you. And this engagement does not actually mean actual change has taken place. So someone may be very cooperative with you. They may show up on time to all of their appointments. They may demonstrate in front of you exactly what you want them to do, but are they taking it home? Are they actually implementing change? That's a whole different ball of wax. So, their ability to hook in with you is one thing. Are they actually making meaningful change is another thing. So, we have two things we can observe. The behavioral components, which are things like, are they keeping appointments? Do they allow you for home visits? Do they turn in paperwork that you've requested? And number two is the working alliance that you have between yourself and the parent. Is there a bond? Is there some sort of trust and respect and willingness to work on mutually developed behavioral goals or not? Now, just because someone is not working with you on a cooperative basis doesn't mean that they can't change. It just means you're not going to be able to watch that change happen on an easy basis. So, the factors that go into assessment. We look at the priority and relevance of the parent, their knowledge and skills, their motivations and intentions, the habits that they have with automatic reactions, and contextual factors. These are the 5 components that go into assessing the capacity for change. And you can even apply these going back to yourself. So for instance, think about your own PMP, the priority and the relevance that you put on the change that I asked you to put in. Okay, how much of a priority is this behavior change? How relevant is it in your overall life, or the salience of the things that you are wanting this person to do? And can and does the parent put this parenting change at a high level of action, or is it at a lower level because other priorities such as their own addictions or their personal beliefs and views get in the way? So, we may have a family in which a child is at risk of removal into foster care or possibly even relinquishment. But if that parent doesn't think that what you're asking them to do is a priority, or other things get in their way to where they can't make it a priority, then that's one of the things you have to assess. And so you want to look at their actions and basically to be able to document how they are putting these into relevance and priority. How much does this child mean to them, basically? And let me back up. That was actually kind of a judgmental statement. I believe a lot of times you will see parents not follow through, and you'll feel like that they don't care about the child, but you have to determine with your assessment what is the barrier that's getting in the way. So knowledge and skills is the next part. And you remember us talking about these weird, wacky contingencies, or that, the efficacy, the feeling of ability. So we're looking at in this situation does the individual have the knowledge and skills? Do they have the capacity needed to change their behaviors? Can this parent make decisions? Can they retain information that's given to them? What's their reading and educational level? What are the gaps in their learning that we must take into consideration? So I've worked with a lot of families with wonderful expressive verbal skills, and then when I've asked them to write me something, like maybe email me back just a simple question, and I realize they can't spell and they have no grammar. And so, my confusion about why they're taking lower level jobs and they can't make ends meet is answered because they can't even fill out a job application properly. So we have to have a really good assessment of a person's cognitive abilities, and that includes learning disabilities and what have you. And so at times this is an important enough issue that you might refer this parent to get an assessment, an academic assessment, so that the courts don't remove a child just because this parent needs extra help for doing the things that they are required to do as a parent. So a simple example, you're trying to enroll a child in school at the beginning of the semester. The parents don't understand or don't have much knowledge of medical care, and frankly they don't usually go to traditional doctors, and so their immunizations are not up to date, and then they've never even heard of what the immunization and what they mean. So that's kind of scary to them. And then maybe they are a little paranoid, they have mental health problems, or they don't actually understand how to fill out the computer online registration process, and there's no longer a paper process to do. And I see that happen a lot now, is that there's a gap in computer literacy and a gap in the ability to have internet with some of these families, and so they're missing the boat. Now, an example of an example of knowledge and skills is this thing called the Parenting Daily Hassles Assessment. And I'm just giving you a few examples of this because you can find this online. But basically, it asks parents questions about normal, typical expectations we have of parenting and what their view of it is. Is it something? How often does this thing happen? Is it rarely, or is it a continuous problem? And how big of a hassle is it? A low hassle is a 1, a high hassle is a number 5. So for example, you're asking them, how often do they have to clean up messes of toys or food? How often are they being nagged or whined at or complained to by children? At mealtime, do they have difficulties with picky eaters or complaining? Are babysitters hard to find? Are sibling arguments and fights, do they usually require a referee? And there's a number of these questions. I've just put a few, like I said, and you're asking the parent to give you, you're having them do this assessment, and it gives you some idea of their realistic expectations of parenting. We all get tired of cleaning up messes, right? We know that it's continuous, and we know it's a hassle. But do we look at it from an overboard situation in which this child is not even worth having in the home because they make so many messes and they cause so many problems at the dinner table? This is what we have to get serious about. So the Parenting Daily Hassles Assessment is a great little assessment just to start off with. Now we look at motivation and intention, and this is the person's intentions to change. In other words, are they able and willing to, put the effort into this? And so needs and expectations. So these are the two components that go along with motivation and intentions. So needs and expectation. If the client is considering change, what are going to be their goals? So what goal are they going to feel is valuable to help them fix the problem that they believe that they have? And do they think that by working on the problem, they will actually be successful? So sometimes you have families that have been in and out of the court system, and you're having them jump through hoops, and they actually have enough experience to know that regardless of how much they jump through the hoops, nothing good is going to happen, because either the district attorney or the protective service worker, somebody has an attitude toward them. And so you may have a parent who says to the judge, yes, I'll do that. And then the next thing you know, they have dropped out of the class or didn't show up or changed their cell phone number because they don't feel that it's a mutual goal, and they don't feel that any effort that they make is really going to change. And then you have to look at their attitudes and beliefs and feelings. Do they feel, love toward their children? Are they glad that they have their children and they really want them? Sometimes we forget that there are parents that are so tired and they really do not want their children, or they're so angry at their children that they don't want to go through all of this effort. And so what are their beliefs about the consequences of their own behavior? Do they even think that there's any negative thing that they've done? And the research supports that if a person has some insight into their own negative behavior and how it impacted the child, you have a better prognosis in terms of change. However, if you've got someone who doesn't think that they did anything wrong and is determined to maintain their stance, your chances of this area being a good sign in terms of change is very low. So there is, along with this motivation, we realize that depression, anxiety, and stress can get in the way. And so there's an assessment, very short, sweet assessment called the DOS 21. It's 21 questions, but I'm giving you a few examples. It's asking, have they found it hard to wind down at night? Are they aware of dryness in their mouth? Do they have trouble experiencing any positive feelings at all? Do they experience trembling? Do they tend to overreact to situations? And you could use this simple assessment to start a conversation with parents about what's getting in their way of being motivated and having the energy. Another scale that's very nice is called the Adult Well-Being Scale, and this is basically looking almost like a Likert scale of 1 to 5. I feel cheerful. I can sit down and relax quite easily, or I lose my temper and I shout and snap at other people. I can laugh and feel amused. I feel I might lose control or hit or hurt someone. So the Adult Well-Being Scale is another added thing that you can use in order to assessments. Now, the other part of motivation and intentions belong to the person's identity and their social role in the family system. And so, what is their gender, their race, and do they have any disabilities that may reflect on how other people see themselves, or how the client thinks other people see themselves. And this may affect their ability to change too. So for instance, if you have a male that you're working with and you are asking them to be less physical with the children that are in their care, are the male friends in their culture going to support their efforts, or is this going to be a battle that you're setting up between the males in the family and your client? And then what is their confidence and their self-efficacy? So we talked about this early on, that for children, if they don't feel that they can perform something, they may not even try it. And so these adults as our clients can relate in terms of, do they have an internal perception of themselves that says, I can't do this, or do they have a lot of confidence that they can handle the changes that you're asking of them? So the key issue here is, are the goals set up mutual in order for them to be effective? Do you have the negotiation skills, even with a hostile client, to come up with some plans that are reasonable, that the client feels like they've had input in, and they can also retain a little bit of autonomy over decision making in that change process? So the more a person feels that they have some control, and the areas in which you can allow for that control, that's how you build a bond, and that's how you get people going. Now, so basically coercive goals don't work. So for instance, we know if someone has a drug or alcohol problem and we're getting ready to remove the child from the home, a typical goal setting type of thing would be to tell the client that they had to go to X number of AA meetings, that they had to get an appointment with a counselor, that they had to be clean and sober for 30 days, blah, 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 blah. And it's more of like a demand, because we know that works, right? We know that there's certain things that we can do with people that will help them eventually, if they're willing to make those changes, help things go better. But if you're working with a client under these circumstances, that means you didn't involve them with the goals. So if you say to them, look, if you really want to look good to the judge, if you really want your children back, here's some of the things I can recommend to you. Tell me what do you think of this? If I asked you to, let's say, go to 6 AA meetings between now and when we go back to court in 10 days, do you think that's possible? Do you think it's reasonable? I think it would help you look good in front of the judge. It's not going to hurt you in any way. I'm not asking you to absorb the learning that takes place there. If you just go and you sit through the whole thing and get someone to sign it, that's all I'm asking. Do you think that's reasonable? If that's not reasonable, what do you propose? Do you have another plan? And you say, so you're saying that you don't want to go to AA, but your church has a Sunday school class that is for people who are trying to maintain sobriety, and you're willing to go to the Sunday school class, but that's only 2 Sunday school classes before court. But I'm willing to put that in there as one of our goals. If you will also, on the other hand, let me contact that leader of the Sunday school class and see if that would, if there's things that would validate what I need to present to the judge. So you're not necessarily working on behalf of the parent, but if you're working on behalf of the child, you have to be working on behalf of the parent. The next area is habits and automatic reactions. So if you go back to the very beginning PowerPoint we ever did, one of the ones we did, and we talked about phobias, and we talked about automatic reactions to fear and fight or flight type of behaviors, that's what this is related to. So these are behaviors that have been reinforced over time, and this is like that ABC contingency issue. And so we're talking about what are the cues and the triggers, and how strong is this automatic behavior. So let's take, for example, post-traumatic stress disorder, and let's say that a father or a mother who are in the military are exhibiting signs of PTSD. So they're having a lot of yelling. They are reaching out to substance abuse because they're having flashbacks, etc., etc. Okay, how often is that happening? What are the things that get that started? How does it end up impacting the children? So we need to do an assessment of the habits and automatic reactions that people have. And then our last area is the contextual factors. I kind of covered it up with the ecology of the person's life, but basically the contextual factors are the things that are around a person. So this would be your antecedents, right? Or the consequences. These are the things that are going on from a socioeconomic standpoint, social class, education, culture, resources, all the barriers that a person may be experiencing, and all of those things that surround a person and impact their behavior. So one of the things that I teach in my parent ed class, I'm sorry that my face keeps moving in here, I'm moving my legs. The eco maps is a really good tool that assess how someone what is going on in context. And so the center circle is your identified client, and the outer circles are all the things that are impacting them. So one of the circles might be work, and one of the circles might be you as the worker, and another circle might be the surgeon who's been making recommendations to the family about the child. Another one might be the neighbor. Another might be grandma or an auntie. And are those relationships strained, or are those relationships supportive? You can use ecomaps as a way to assess that. Now, the contextual factors that we really, really want to pay attention to if you're working on a case that is a Child Protective Service case, these areas significantly impact the ability of a person to change. And so you have to take very special close notice of these. So the ones with a lot of asterisks, it's a very gloomy picture of this parent's ability to change. So if we have long-term substance abuse, drinking or drugs, if there's extreme domestic abuse and a long-term history of it, if there's mental illness, we're talking bipolar disorder, major depression, schizophrenia, any of those brain disorders that are really out of that person's control. And above all, if this person has no ability to have empathy of any sorts. So when you're interviewing them and you see that the type of abuse that was involved was very malicious, hateful, planned, very sadistic in nature, okay, that's not a good sign. Borderline personality disorder, people with unresolved childhood histories of abuse and maltreatment, significant learning disabilities, physical health conditions that get in the way, and of course learning disabilities. I repeated, so I apologize. But all of these can really impact a person's ability to make changes. The other rare things that come up and are actually very unlikely that you'll deal with, but I want you to keep in mind. So anytime you have a serious child protective concern and it is not matching up with the child's time frame. So what does that mean? Well, one thing we have learned through the research is that parents' best opportunity and the quickest time in which they will make change is between the birth of a child and the first 6 months of that child's life. If you're going to see change happen, this is when you'll see it with parents. After that point, if you see no change in their drinking, their drugging, their cruel words, their harsh treatment, their neglect, if that has not happened within the first 6 months, your chances of there being a positive outcome between the parent and the child goes downhill very rapidly. And yet, this is also when we sometimes fail to take action because we have not done our homework, we have not done our assessment tools, and we don't have the courage, to be honest with you, to go before a judge and get things taken care of with a child at a young age. And so sometimes these babies get drawn out, their time frame gets drawn out too long. So a parent's failure to acknowledge the problem, if they have extreme domestic violence to where you're afraid to even put the people in the same room together, or if you have a parent that fails to protect children from perpetrators of sexual abuse, a mom, this is typically the scenario where a mom, basically goes from one man to another, and regardless of repeated reports to protective services, allows that abuser to come back into the home and really is more likely to get rid of the child than they are to get rid of the man. And then if you have deliberate abuse that's been very extensive and systematically covered up. So these are like those horrific cases of child neglect and child maltreatment where somebody's found out that there were children in the home for 10 years and nobody realized they'd been starving them. These cases, it is very unlikely that you could even think about trying to create change in this. So how do we assess all these factors that go into change? And so our basic social histories are really important, using these standardized tools that I mentioned, and also just plain observation, watching things happen. I worked on a case in which we demanded that there be supervised visitation. And what would happen is the father had to meet up with the child at this house that had trained workers there observing the behavior. And so father would be totally appropriate, except for when the child would say, hey, Daddy, I got to go to the potty. And the worker would allow the dad to go into the restroom. And it was in the restroom that the dad would be telling the child, your mother is a whore, your mother is a bitch, your mother, these horrible, horrible things. Your mother doesn't love you. She doesn't love me. She's going to leave you, and so you need to tell everybody you want to live with me. And so then they'd walk out of the bathroom, everything would look perfect. And so we had to actually talk to the workers about, why were they, if this is supervised visitation, why were they allowing the parent to have that alone time with the child? Because all it takes is seconds for a child to be, affected by these type of things. Time scales is another way, very much like scatter plots or whatever, where you measure the needs of the child based on their age and the time frame, and how much of the changes are taking place rapidly. So what this basically boils down to is you look at the age of the child, and then you look at the severity of the parent's problems, and you try to determine if, based on the parent's problems and the amount of time that it takes to get those fixed, should the child be left in limbo or left in the home in a dangerous situation for that long, or should they be removed? And if they're going to be removed, is it fair to remove them and not give them permanency planning because you didn't jump on the change process quickly enough? So again, the first 6 months after the birth of a baby is the most key time when people are willing to make a lot of changes in their life. And the same goes, though, if you have a drug or alcohol problem, the first 6 months of any change is when you have the highest relapse. And it can take 4 to 6 months alone just to assess the capacity of the person to change. And then it takes between 5 and 10 years for a serious drug addict or alcoholic to actually get fully stable from not drinking and using. And so here we go. This is where time scales come in. If you've got a baby, do you want this baby to be in foster care for 5 to 10 years for a heroin, addicted mother and go through all of the relapses and what have you? That's probably not realistic. And, can you find, based on the supports in the family system, can you find someone really rapidly and quickly within the family that would be a good choice? And is that person going to actually protect the child too? Because you get these 3 or 4 generations of neglect, abuse, and what have you, and sometimes you're putting the child into an even worse situation. So we've done all these assessment tools, right? And we've developed basically through the process of this an FBA. You've looked at the baseline of the parents' behavior. You've used assessment tools that we found in the book. You're counting how many times did they drink that week, how much did they drink that week, or the number of times that the child has ended up with bruises, or reports self-report from the parents for yelling, or maybe you do a trigger analysis and you set up a situation to frustrate the parent and basically see how they're going to handle that kind of situation. And so all of that goes into these factors. So you're using your appropriate assessment tools to establish your baseline. You're identifying the target behavior that the parent is doing that is most affecting the children. Is it their hitting? Is it their yelling? Is it their being out all night and leaving the child unsupervised? What is the function of the parent's behavior? And then you've got to decide on that intervention strategy, all of those things that I gave you that were in the PowerPoint 15, I think it was, or 14, where every function has its choices of what will work. But you've got to take those choices, those intervention strategies, and negotiate with the parents in terms of what is going to work best for them. You can't just decide you're going to use a certain replacement behavior and expect the parent to go for that. You've got to negotiate that. And then number 5, you've got to provide very, very clear instructions for the intervention that you're asking. So if you tell this parent, I want you to go to 6 AA meetings this week, then that means it also needs to be written down, and there needs to be a chart so that somebody can sign for it. You don't want any misunderstandings. And if the parent is complying and they're doing these changes, they deserve to have the credit for making those observable changes and documenting them. That's your responsibility to do that. And you may think, now I'm going to be, I'm an early childhood interventionist. Well, your child protective service workers who are maybe working with the children who are in foster homes that you're providing services for, they look to you to be the expert on the children. They don't have the expertise that you do on infant development. So you sometimes will end up in a court situation having to testify, and I'm hoping that you will take this PowerPoint with you and show the parent's ability, the things that the parent needs to do for this particular child involved and what the changes are going to be. So here's another way of looking at it. So on the left-hand side of this triangle, we have the child's developmental needs, we have the parent's capacity on the right, and then we have the family environmental factors that all go together as to whether the parents can, should make the attempts to change for the benefit of the children. Okay, this is another really great document called Decision Making Within the Child's Time Frame, and I wanted to point it out to you. This would be a document that I recommend that you get, because somebody has done an incredible amount of research into what works and what does not work, particularly with Child Protective Service cases. Now, in that book, they talk about these pathways to permanency. And so and this is kind of a diagram I thought was really cool that they have developed. And so on the left-hand side, it has the age of the child. Then in the blue, it has the key points in a child's development during that time frame. In other words, what's the brain doing? What kind of learning is taking place? Then in the peach color section, it's the proactive casework and the timely decision making that you need to have at these ages and stages for positive outcome. So if it's a pregnant person during pre-birth, then the example here is you should have a pre-birth assessment. So in this case, you should use your pregnancy, anxiety, and stress assessments. Some of this is in my parent ed class. Or caregivers class, and then you want to look at proactive social care casework and finding out who is going to be available for support of this mother during her pregnancy. This is sometimes when you want to get parents involved and engaged with intensive parenting programs. Some parents will address some but not all of their difficulties during this time, but domestic violence and substance misuse is something that you have to be really on top of if this is during a pregnancy. And if extended family members have offered support, this is a time when you want to encourage the parents to accept the support unless it's just a horrible situation. Then in the green is the reactive casework and delayed decision-making problems that, what will happen if you're doing this. So the peach is what you want to be doing. The green is what you shouldn't be doing. So sometimes you want the assessment, the pre-birth assessment is inconclusive. Sometimes the social worker gets the parent, pregnant parent into some sort of a program, and so the crisis is kind of gone away for the moment, and so they are not proactive with helping them, get parenting and what have you. And then you're not addressing domestic violence, you're not addressing the extended family members and looking for support, so when that baby comes, you'll have some options. So I went ahead and put their examples of this all the way through. Yeah, so each one, so I made a list of assessment scales that are free and are available for you as a interventionist. You don't even need training on them because they come with how to scale them and how to interpret them, and these all come from the article that this whole PowerPoint is set up to be. So the moral of the story is that you've learned your FBA stuff, you've learned your behavioral interventions, you've learned how to write that all up, but if you don't have a parent who can implement those things for the child, then you have to stop what you're doing and you have to do a different assessment, and you have to assess that parent's ability to change in order to help the child with this child's behavior. Or you may totally decide that it is not the child at all, that the focus needs to be totally on the parent and making that parent a functional person.